the problem is most doctors are not aware of the research that's out there. A lot of doctors kind of have this opinion that, once you have autism, it's kind of like, sorry, you're kind of out of luck. There's not much you can do here. I've even had patients come in and say their doctor told them put their kid in an institution and focus on their typical kids.
Welcome to Beyond the Blue, a space where we bring awareness and understanding to the daily lives of individuals on the autism spectrum. In each episode, we have meaningful conversations with experts, families, and advocates, shedding light on the challenges and successes in the autism community. Today, I'm delighted to be joined by Dr. Dan Rossignol, a renowned pediatrician and autism specialist. With over 2 decades of experience in treating children with autism, Dr. Rossignol has dedicated his career to advancing and improving outcomes for those on the spectrum. His innovative approach and commitment to evidence-based practices have made him a leading voice in this field. In our conversation, we'll explore key insights into communication strategies, medical treatments, and how families can best support their loved ones. Let's jump right in and welcome Dr. Rossignol to the show. Welcome to Beyond the Blue, Dr. Rossignol. Thank you so much for joining me here today. It's truly an honor to have you on our podcast.
Thanks, Monsi. I appreciate the invite.
Of course. Now, to start off, for many families, receiving an autism diagnosis can feel like an emotional roller coaster. It's a moment filled with both uncertainty and hope for the future. Dr. Rossignol, my first question for you is, what advice would you give parents who are just starting this journey?
Yeah, when our kids were diagnosed, when our first child was diagnosed with autism, it was kind of a shock, so you don't always know what to do at that point. So we had to lean on professionals, people that knew about autism. At that time, this is about 20 years ago, there weren't a lot of parents out there who had kids with autism. So like today, there's a lot of support groups like TACA, which is the Autism Community in Action, is really good because those are parents who've gone through it and they can mentor other parents. So it's good to reach out to people like that. First, when your child is diagnosed, you kind of don't know what to do, and sometimes you're in denial. And when you're in denial, you sometimes don't really do anything. So you have to mourn and, pick yourself up and get going too, though. So you got to reach out and try to get some treatments for your child. So the first thing you do, I think, is look for therapy, especially ABA, Applied Behavioral Analysis Therapy, which is the best proven therapy for autism. And then I think seeking out other parents as far as what they've done for their kids. And then we would suggest seeing, a doctor who does, interventions for autism, not just, biomedical or, complementing alternative treatments, but also mainstream treatments too. Because there's a lot of things that the child needs to be tested for. A lot of kids with autism have seizures that you don't even recognize. A lot of kids have underlying medical problems, GI problems, medical problems that need to be screened for, tested for, and then potentially treated. So I usually encourage parents when they're at a conference and I'm talking to them is get up and get going and do something. To get some help, seek out other people so that you could try, to get your kid where they need to be.
Thank you so much for sharing. Can I ask, what led you to this field?
So I'm a family doc by training, and I was trained in evidence-based medicine where you look at the evidence for what we do and try to figure out what works. And so that was my background. I was working in family practice and seeing patients with diabetes and hypertension and delivering babies and doing all kinds of things. And then my older child was diagnosed with autism, and then my younger child was diagnosed as well. And at that point, I remember I was at a university and I went to the university docs there and I said, hey, my kids have autism. What treatments are available? And they pretty much said there's nothing. And I said, you know what? Well, I've heard people talk about these diets and supplements and things like that. And they said, oh, there's no evidence that these things work. So I was like, oh, okay, well, they must know what they're talking about. And then my wife, she's the one that decided I'm going to seek further help. So she started talking to other parents and seeing other doctors. And they suggested my kids go on a gluten-free and casein-free diet, which I thought was kind of silly, but whatever. And they started showing improvements, especially in like my older kid would have diarrhea 5 or 6 times a day. And we went on the diet, his diarrhea cleared up. And we had seen a GI doctor at the time, and he said, this is just part of autism. And I remember asking him, like, well, should we do a stool test? Did he be scoped, for the test? He's like, no, it's just part of autism. So I'm like, oh, okay. I mean, he must know what he's talking about. So when my kid's diarrhea got bad, I'm like, oh, okay. And then my wife started giving them supplements, and they started showing improvements, like more than I would have expected them to show. And I'm like, okay, there's something going on here. So then I went to the library and I just started doing research, and I found all these studies. I found like 20 studies on the diet and autism. Now, maybe you could say they're not the best studies in the world, but there were studies, and I was told there are no studies, right? So I'm like, okay, I'm trained in evidence-based medicine. I'm stupid. I got to go in and look for myself. I got to follow my mantra and figure out what's out there. And that's when I started doing research, and then inevitably that led to treating some patients with autism in my practice, and the practice going, you're seeing too many kids with autism, you got to stop. And me going, okay, either I got to stop or I got to keep going. And then I decided to go into autism full time.
Effective communication with children on the autism spectrum is essential. Many children face communication challenges, and up to 40% are nonverbal. Research shows that early, tailored strategies can improve social skills and reduce behavioral issues. However, parents and educators often feel unsure about how to approach these conversations or interpret nonverbal cues. In the next segment, we'll explore key strategies for communicating with children on the autism spectrum. Dr. Rossignol will discuss practical techniques to help improve interactions and understanding. One thing that often comes up is how to build and maintain meaningful communication with a child who's on the spectrum. From your experience, what are some ways to improve communication as your child grows?
Yeah, I mean, certainly speech therapy is foundational. So getting a good speech therapist involved is really, really helpful. And they usually have resources. Um, Talking to your child as if they understand you 100%, because a lot of kids with autism understand a lot, if not everything. But because they can't speak, a lot of people sort of presume they don't understand. So instead of talking to them in baby talk or using incomplete sentences, use a full sentence, talk to them, like you would anyone else. And presume what we call competence, presume that they're competent, that they understand, because they may very well. A lot of kids, we now know from some studies in nonverbal kids with autism that the speech center of the brain is acting normally if you measure on a functional MRI, but it's not flowing out. So they can actually, in the brain, think what they want to say. They just can't get it out the mouth. Sometimes you can get it flow other ways, like through a finger, like either typing, using PECS, which is like a picture exchange system where you take a picture of something, or typing on a keyboard, or using a device. All those things can help with communication too. So that can get communication going, but definitely speech therapy and presuming that your child knows a lot and talking to them as such, I think makes a big difference. And then, of course, spending time with them. Sometimes, you get I see some parents that get so into research or maybe helping other parents or getting involved with just autism advocacy that they sort of kind of forget their kid at home. Like, okay, you guys spend time with your kid too. And that's, of course, really important in all our lives, especially when we're all busy, right? So,
but when verbal communication is limited, what are some other ways families can still bond with their child?
Yeah, I mean, we're all pressed for time, right? And until maybe we retire, we're all just running around putting fires out. I feel like half the time putting fires out, so you just have to remember to spend time with your family at home and schedule time with them and make sure that you do things they enjoy. But yeah, I mean, some kids can communicate other ways. Like some kids will learn sign language. I've had some kids learn I have some kids that can't speak at all, but they can type an entire paragraph for me. So there's something called picture exchange system, PECS, where, you might pick up, like if you want a juice, you pick up a little juice picture and you show it to somebody, or you gesture. So there's other ways to communicate where you can kind of understand what they want. A lot of kids are pretty good at pointing, pulling you, doing whatever. You just have to kind of be open to that and listen to it. We all want our kids to speak verbally. And I have some kids in the practice that are nonverbal. Like I've had one kid who's written 2 books and he's nonverbal and he's done it by typing and so forth. So, I mean, you can, obviously we all want to communicate verbally, but there's other ways to communicate too that are effective. If you remember, Stephen Hawking, he couldn't speak, but he had that device that would read his brainwaves and then speak for him. So I think that type of stuff, as it comes online, is going to help a lot of kids get their voice too.
As families work to build communication, it's also important to understand how to address moments of frustration or misunderstandings. Are there any calming approaches that can help both the child and parent during these moments?
Yeah, I mean, obviously, from a medical standpoint, we oftentimes look for causes of things. Like some kids will be frustrated or be aggressive because they got gastrointestinal pain or bad bacteria in the gut, or even a seizure can make kids act out, be aggressive or be frustrated. Or sometimes there's deficiencies like low cholesterol in the blood, which might sound funny, has been shown to make some kids aggressive and frustrated easily and so forth. So a lot of times we're trying to find those underlying medical issues, which involves doing some testing to identify them. So we identify those problems and treat them. Or we might use a treatment that's been shown to help with frustration or aggression, whatever, like medications or nutritional supplements. Some kids really respond poorly to certain foods. Like you just probably heard FDA just banned red dye number 3 because we know it causes kids to kind of go hyper and repetitive and so forth. So sometimes avoiding artificial colors, preservatives, certain foods can be helpful. But as far as like calming the kid down at home, there are other measures. So obviously, yeah, again, presuming that your child understands and talking calmly to them. Some kids respond really well to weighted blankets or squeezes or hugs, or some kids don't like my younger kid likes hugs and squeezes, but my older kid doesn't like it so much, or touch as much. So you just have to some people find that brushing, kind of helps to brush the skin or brush the hair. Massage, has been shown to help with sleep and kids with autism. Music therapy is a big one. A lot of kids really enjoy music. And so having like music they can listen to, it can be really soothing and calming. So a lot of these strategies you can do at home and of course, making sure the child, has good sleep, because if you don't sleep well, you can get kind of cranky and stuff too. So, ensuring that sleep is good. So we spend a lot of time with our patients, making sure that we test to figure out if there's a sleep problem, treating the GI issues. Because if you have pain in your stomach or diarrhea or constipation or whatever, you might not feel that good. So we try to help them with that as well.
Yeah, and I'd love to hear about your own experience working close with families. Were there any particular moments that stand out to you from your practice?
I mean, there's a lot. I mean, it's kind of really satisfying to see a kid recover from autism or leave autism behind. I mean, the autism is a diagnosis based on behavioral observation. So it's based off speech delay, social communication problems, repetitive behaviors. So because it's based on your symptoms, if those symptoms go away, especially for a substantial period of time, then you can, quote, lose the diagnosis of autism. So that's obviously what our goal is. I mean, I had one child with autism who treated in our practice who got into Harvard. I've had many kids get into college. My younger kid is in his second year of college right now. So, that's really satisfying. Even, some kids don't get all the way there, and we have some kids that get 90% of the way there. Or some kids where they come in and they're sleeping 2 hours a night and they're throwing their poop against the wall and they're beating people up, and we can make them calm and have, better GI system and have them sleep and so forth. So even that type of thing can really improve quality of life. So a lot of it is improving quality of life. The other thing that we like to address too is some people say, oh, if you're treating the child with autism, you're trying to change who they are. And we would argue that no, we're trying to treat their underlying medical problems. Like, who wants the child to have a seizure? Who wants them to have chronic diarrhea 5-6 times a day and throw poop into the wall? Who wants them to sleep 2 hours at night, right? So we try to improve these underlying medical issues. And then a lot of times when you do that, there is improvement in brain function and behaviors and things like that. And we're not trying to change them into somebody who they're not. We're just trying to make their life better. A lot of it's quality of life for the family, quality of life for them, and so they can thrive in life too.
From your experience, what are some of the biggest misconceptions parents have when it comes to parenting a child on the autism spectrum?
Well, I mean, definitely the thought that autism is treatable is kind of something that a lot of people don't understand. The problem is most doctors are not aware of the research that's out there. So, for example, take melatonin. Melatonin is a supplement that you use for sleep. There's over 40 studies using autism. There's like 12 double-blind studies where they compare it to placebo showing benefit. None of the studies, except maybe one, show really significant side effects. In fact, one of the studies used it for 4 years straight, and it was very safe. But I still have patients come in and it's like, my doctor said I shouldn't use melatonin. It's kind of dangerous. It's like, well, no, the studies don't show that. It's actually quite safe. In fact, if it was a drug, it'd be the number one selling drug at all time. So I think there's sort of this thought that if a treatment is not a prescribed medicine, if it's a diet or a supplement or something like that, that it can't possibly work because only medications work. We use a lot of medicines in our practice, no question, but I've been impressed with some of the treatments like nutritional supplements and diets that can have an effect with some kids. So that's one thing is, a lot of doctors feel, well, if you're not doing a medication, you're probably not really, going to have an effect. And number two is a lot of doctors kind of have this opinion that, once you have autism, it's kind of like, oh, I'm sorry, you're kind of out of luck. There's not much you can do here. I've even had patients come in and say their doctor told them to put their kid in an institution and focus on their typical kids. Don't waste time on the kid with ASD because they're going to have an institution anyway. There's a lot of that out there. So, and I think the other thing is sometimes doctors, if they don't know something, instead of saying I don't know, they might just say it doesn't work. So I've had patients go to the doctor and say, hey, what about these treatments? And be told that there's no evidence, no studies. Same thing I was told almost like 20 years ago, no evidence. And then you go to the library and you look up the evidence and there it is, right? So I think a lot of doctors just have this misconception that autism is treatable, and therefore most parents feel autism is treatable. In fact, most of my patients come from word of mouth from other parents. They kid had a pretty good outcome, and so they tell someone else and they come see me. I wish we could get the word out more. I thought by now, I've been treating kids with autism over 20 years. I thought by now, because it takes about 15, 20 years for medicine to change, I thought by now there'd be more awareness, more doctors would be treating kids with autism. I mean, I'm working on a paper now on all the medicines and autism, and another paper on all the supplements. And there's only over 50 meds that have been studied, over 60 supplements have been studied in autism. So the data is out there. It's just most people don't know about it. So just getting the word out that, hey, there are things that are abnormal in autism that you can test and treat. And when you treat those things, you can sometimes improve behavior, symptoms, brain function, speech, attention. We even treat kids in our practice who have ADHD or anxiety or depression. It's the same story. They oftentimes have underlying medical issues that are causing the problem. So you could put a kid who's depressed on an antidepressant, which, I mean, they do work, or you could treat the underlying cause, which would you rather do, of course, right? We don't have all the answers. It's not like we're saying we can fix everything like that, but we keep searching and we keep trying to treat underlying issues. And so I think the misconception is that autism is not treatable when in fact it is a medical condition. Right now it's classified as a psychiatric condition, and we think it should be a medical condition because it has the same underlying features of medical disorders like diabetes. Diabetes, you have high glucose. In autism, you get all kinds of metabolic problems that you can test for and treat.
Treatment for children on the autism spectrum is as diverse as the spectrum itself. According to recent studies, early intervention and personalized treatment plans can lead to significant improvements in development outcomes. Yet, with so many options available, from behavioral therapies to medical treatments, navigating the right path can be overwhelming for families. In the next segment, Dr. Rossignol will break down how personalized plans are developed. We'll explore how medical tests, parental input, and targeted interventions like diet supplements and medications play a key role in improving outcomes for children with autism. Treatment for children on the autism spectrum is always tailored to each, individual's unique needs. But with so many approaches available, I'd love to hear your perspective. What do you think is the most important focus on, when developing a treatment plan? Is it communication, behavior management, addressing sensory needs, or is it something else?
It's whatever the parents think it is. So when I see parents in clinic, we'll go through the whole list of how's your kid speaking and how's the GI and how's the sleep. And we'll ask all these questions. We'll ask about the pregnancy history and the family history and all these things, right? But at the end, towards the end of the appointment, as we're getting ready to decide what to do on the first visit, I'll ask the parents, what do you want to work on? What are the biggest, hindrances that your child has? What are the things if you had a wish list, things to get better, you can improve, what are your top 3 or 4? I mean, speech is up there many times because a lot of kids, speech is a big problem. Attention tends to be a big one. Aggressive, self-injurious behavior, hyperactivity, self-stimulatory behaviors, sleep, GI, these are common things. So if the kid has pretty good looking bowel movements and the GI problem is number 6 on the list, we don't want to put our effort on that if we should be focusing on speech number one and maybe STEMI number two or whatever it might be. So it's whatever the parents think it is, what they think is holding their kid back the most. Sometimes they get that from teachers like, oh, the kid's in a special needs classroom. Well, ask parents what keeps them from going to a regular classroom. Oh, it's because he throws tantrums. Okay, well, let's try to get the tantrums down and maybe we can move on in class, because that will be good for the kid to move on to a better classroom environment. So it's whatever the parents think it is. And then we devise the strategy. So as far as treatments go, I look at it as two ways to really approach deciding on what treatment. One is based on laboratory testing. Okay, your kid has a bad bacteria in the gut. Maybe we should treat it. Your kid has low iron and zinc. Okay, treating those helps attention. Your kid has a mitochondria problem, which can cause autism by impairing energy production. Okay, we can treat that. Your kid has seizures. Oh, we should treat that. Your kid has sleep apnea. Okay, let's treat that. So that's all based on the laboratory testing. That's how you individualize the treatment. So we want to individualize the treatment for each kid. We don't want to treat every kid the same way every time, right? Because one kid, the big problem might be seizures and speech delay. Another kid, it might be GI problems and thyroid issue, right? So the testing helps you individualize. The second way we decide on treatment is use things that have been studied. So for example, the best studied medication for speech and autism is a medicine called propranolol. It's been shown to help with speech output. It helps the words flow out more easily from the brain to the mouth. And there's, I think the last time I looked, about 12 double-blind studies where they compared to placebo, showing that it was improved. There's improvement. To get a drug FDA approved for a condition, you need generally at least 2 double-blind studies. So propranolol has 12, right? But it's not approved by the FDA because the manufacturer of propranolol, whoever that was 60, 80 years ago, because it's really old med, would have to apply and get propranolol approved for autism. But there's no desire or any reward for doing that, because if I spend $1 million, $100 million to get propranolol approved for autism, then the next drug company is going to come along and just make it and undercut me, because you can't patent it because it's now a generic med. So there's a big problem in the U.S. with certain medications have a lot of studies behind them for autism, and they're pretty well proven, but they're not FDA approved. So then doctors don't want to use them sometimes because they're not FDA approved. So we tend to use a lot of treatments based on medications and supplements that have been studied. So we use things that have been studied, that have low risk, that, are older meds too is helpful. And we base treatments off lab results.
So I'd like to shift gears a bit. According to a CDC report, as of March 2023, 1 in 36 8-year-old children have been diagnosed with autism spectrum disorder, up from the previous estimate of 1 in 44 in 2018 and 1 in 68 in 2010. Why do you think more children are being diagnosed with autism now?
Well, it's important when you look at these dates too. They're looking at 8-year-olds, right? So in March 2023, looking at 8-year-olds. So these are kids that were born in 2015. So you're really looking at rates from kids that were born 6 or 8 years ago, not rates that are like right now. So it's always delayed because you have to wait for a child to get autism. So you're definitely 4, 5, 6 years behind the estimate, just based on that. Depending on what study you look at, the rates are sometimes even higher. So the other thing that they do is by lumping boys and girls together, it makes the rate look not as bad. So it's about 1 in 25 boys, 4% throughout the U.S., but about 1 in 100 some girls. And when you put them together, it's 1 in 36. 1 in 36 sounds a lot better than 1 in 25. So it's a way to kind of, and then there's a study that came out in California this past year. And I had to go into the study, into an obscure table and calculate this myself. But the rate of autism in boys in California is 1 in 13.9. It's 7% of boys in California have autism. Didn't make the abstract, didn't make the headlines. It's kind of like people don't want people to know about it, that many kids have autism. Now, in California, there are a lot of services available compared to other states. So it may be that people move to California to get better services. So that could certainly make the rate higher than it would be in another part of the world, of the country. But really, frankly, the autism rate in boys in the U.S., it's 4%, if not a little bit more. So that's pretty high. Why are more kids getting diagnosed? Well, the studies I've looked at have shown about 15% of the increase is related to, we used to call it something else. We used to call it, retardation or something else, and now we call it autism. So that's about a 15% increase. The other 85% is a true increase. And we think that a lot of it's being driven by environmental things. So if you look at, say, genetic disorders like Down syndrome, the rates don't change much because your genes don't change much. So your genes will change over hundreds of years. So over a couple, 300 years, maybe the autism rate goes up because genes shift and change and so forth. They don't change over 20 years. So it's got to be environmental. Initially, from studies from the 60s, 70s, 80s, it was felt that autism was about 95% genetic and about 5% environmental. Now it's more like maybe 40% genetic and 60% environmental. So a lot of it's being driven by things like air pollution, pesticides, chemicals, things in the environment. In fact, air pollution, the study on air pollution now shows is a leading cause of heart disease, dementia, brain inflammation, all kinds of things. So a lot of it's our toxic load, I think, in the environment. And some of these things get easily into the blood and disrupt metabolism and so forth. So even for wildfires, unfortunately, the little particles from the wildfire go down deep in your lung, go right in the blood, and can cause problems. So I think it's being driven a lot by environmental issues, more so than anything. And it looks like what we see with kids with autism is that they're just more vulnerable. They're not as resilient. So when they get exposed to something, they kind of fall apart more quickly. Because most of the studies looked at toxicity will compare levels of one toxin in kids with ASD and typical kids. They're kind of equal, and they go, so therefore there's no cause here. But if one population, if the kids with autism are more vulnerable, they could fall apart at the same level of toxicity as another kid's. It doesn't fall apart. So we think it's a vulnerability. And so what we do a lot in practice is try to improve the resilience of the child by improving their detoxification pathways, their mitochondrial pathways, all these different pathways that are compromised and so forth. But yes, it looks like it's mainly driven by environmental factors, maybe some of which we don't even know yet.
So I want to ask two follow-up questions. The first one is, as per your experience, how much is a child held back when their diagnosis has been carried out a bit later than maybe another person's?
Oh, it's a big, big factor, I think, because we know from studies that the younger the child is when you treat them, the more likely they are to make progress. This is based off ABA studies, behavioral therapy studies more than anything. And so it's just like anything else. If you have a cancer and you catch it earlier, you probably can do better than if you wait later. Same thing with heart disease, diabetes, all these things, all these diseases will impact your body and damage it over time. So the thought is with autism, the younger the brain is, the more plastic it is. I had one kid in my practice who had a brain tumor. He didn't have autism, but he had a brain tumor when he was young. About 7 months, he had a third of his brain removed. And part of the areas he had removed were areas of the brain that control like arm and leg movement and speech and so forth. And he was able to walk and talk and do things normally because the surgery and the brain tumor removal happened at such a young age that other areas of the brain were able to take over. That's called brain plasticity. And that tends to kind of wane and get less and less as you get older. And by 5, 6, 7, it tends to kind of wane a good amount, although I have some kids that are much older than that still progress. But you really want to catch it early. And what we know now, and even the American Academy of Pediatrics it warns their members that there's a failure oftentimes to refer or diagnose, especially in boys. Boys can speak late. They can be a little bit delayed. Why don't you give another 3 months, give another 6 months. They come back in 6 months. Okay. Sometimes we see boys a little bit slower, and then they don't get referred on and there's a delay. And really, in my opinion, it's malpractice because it's like failing to refer anyone else for timely treatment and so forth. So the studies in the US show that most doctors, including family docs, pediatricians, don't refer early enough. They're delaying too much. And so there needs to be a change in that too, because early diagnosis is key. The earlier you can find all this stuff and treat, the better the kid's going to do. And you're wasting the child's best years if you're not, referring and getting things done. The other thing I see in some parents is their kid gets diagnosed, and I understand. I've been there. You mourn. You definitely say, "Hey, I thought my kid was going to be, a doctor too, and now he may not be, right?" Or whatever. Or some people want their kid to be the next quarterback of the NFL team, or whatever it might be, right? The dreams they have, and you kind of have to give those up sometimes, or at least put them aside. But sometimes what it leads to is inaction. So I have these parents like, well, we're going to start maybe in a year or so. We're going to kind of think about it. And I'm like, well, you're wasting the best year of the kid's life by delaying. You need to move. And so some people, it takes them a year or two to come around. Okay, now I'm ready. I'm like, well, okay, that's great. Let's start. But you should have started 2 years ago. So also just getting going, man. You just got to seek care and you got to fight it. I tell parents sometimes you feel like you're crawling ahead in the mud trying to get improvements to your kid. You just got to keep persisting and pushing forward. You just got to keep trying. You know, that's the key thing. So anytime I see a new parent, I said, I know it's tough. You're probably mourning some too, but you got to get off the couch and you got to move.
Fantastic. Thank you for touching on that. You also mentioned something about detoxing. Could you talk more about that?
Yeah, I mean, so we know that there's something called glutathione in the body, which is your body's main detoxifier. So it attaches to like heavy metals and pesticides and chemicals and helps to get rid of them. And we know in kids with autism that their glutathione levels, as a whole, in general, tend to be much lower than in typical kids. And so things that improve glutathione levels, like B12 injections and folinic acid and some of these supplements that we use, by improving glutathione, you can improve detoxification. Um, there's also something called sulfation, which is another way of getting rid of toxins, especially pesticides and chemicals. And kids with autism tend to have low sulfur pathways. So sometimes giving, magnesium sulfate and these type of things help with detox. So a lot of times we'll look at toxicity. Definitely I've had kids come into the clinic, first new patient who have high lead and mercury in the blood. I mean, that's ongoing exposure and you got to get rid of that right away. So I had one kid that was eating a can of tuna twice a day, every day of his life practically. And his mercury level was 25 and it, should be under 10. And so he was kind of mercury toxic, so to say. So we had to stop the tuna, and kind of give him some treatments. One of the treatments that's been shown to remove metals from the blood is NAC, N-acetylcysteine. So we put the kid on NAC and that helped a lot. But yeah, you have to assess. So oftentimes we have to do some testing to see if there's exposure. And then potentially augment the detox pathways with, certain supplements that boost glutathione and sulfur pathways and so forth.
Can genetics, or more specifically, racial biological traits, cause bias or influence the likelihood of someone being diagnosed with autism spectrum disorder?
I mean, it's certainly possible. It depends on where you live in the world. Like the average age of diagnosis of autism in gosh, I forget which state. It's a Midwest state. I don't want to say the wrong state. Was 6 years old. I mean, that's just pathetic. So definitely where you live makes a big difference. Like in California, there's what I call regional centers, which you can go to and get a diagnosis and so forth. And so people tend to get to these centers pretty quickly. But in some states, the diagnosis is like at 5 or 6 average, which is kind of pathetic. When the CDC does studies, they'll go in Atlanta classrooms and look at autism prevalence, and they routinely find about a third of kids who have autism have not been diagnosed. They're in kind of a slow class, or they're retarded, or whatever the label is, but it's the wrong label. They haven't been diagnosed. So there's definitely a failure to diagnose in certain areas, and it depends on where you live. There's been some studies showing that kids who live in inner cities get diagnosed later. So it's definitely, and a lot of it has to do with access to proper health care. If you have poor access to healthcare, or maybe you don't have insurance or whatnot, you could definitely have a delay in diagnosis, which is really, really sad. I don't know why in this country we don't prioritize, our kids more. And I wish we had more funding that was put aside for studying autism and helping kids with autism and diagnosing early, because these kids can make a lot of progress. I had a slide in one of my presentations from about a decade ago where I put up a slide saying the number of drugs being developed for autism at the time was about 3. The number of drugs being developed for erectile dysfunction, 15. Why do we need 15 drugs for erectile dysfunction? We need more drugs for autism, right? So, I always joke, if autism affected middle-aged men, we'd probably have a cure by now. Because that's who controls. I mean, it's really Congress, mostly middle-aged men for the most part, that control funding and so forth. So I'm hopeful with maybe the new administration and stuff that maybe there will be more funding for autism. And we've submitted actually some proposals to the White House and stuff to try to get more funding for autism research. So we'll see how that goes.
Oh, that's fantastic. Yeah. So what changes or advancements in treatments and research do you anticipate will have the most impact on families and those with autism?
Yeah. I think, artificial technology, AI and stuff, I'm already seeing some advancement there, because we're using AI to data mine research papers and finding new insights and stuff. They did this with cancer research a number of years ago, where they had AI look at all the cancer research. And what happened with that is a lot of new ideas came out that weren't previously thought about. When the AI digested like hundreds of thousands of articles, it was able to pull out main ideas of things that no one had really looked at or thought of. So I think that we're we're right on the cusp of that with autism research, using AI and stuff. In fact, we have a website that we're working on, which is going to be an autism clearinghouse, which is going to have a lot of studies and things related to autism. Um, that's going to be available pretty soon, and so forth. So what we're going to have is about 50,000 articles on there, and we're going to have a synopsis and summaries and ranking of articles, and people can go in, especially doctors, and they can rank things and kind of move things around and so forth. So we're excited for that as well. So that's coming down the road in addition. So, but a lot of it is just categorizing what's already there, because there's a lot of stuff there already. Like a lot of parents will come in and say, what's the newest thing for autism? Like, well, you haven't even done the 10 old things yet. Let's do those things first. And maybe we go to new things in a minute here. A lot of the new stuff that's out there is kind of unproven and can be very costly. So I do kind of worry about people being taken advantage of for treatments that may not be ready for prime time yet, especially when there's proven therapies out there. A really good example is stem cells. Stem cells are being used for autism. It's very expensive and the data is pretty weak. And there are some parents that do see some progress with it, but it seems to be not huge, and so it's kind of hit or miss. So love to see more research in some of these areas too. So we definitely need more research funding, and then obviously discover new drugs. So we're doing a study right now. We just started it. We're giving this IV medication that's used for Alzheimer's, and it targets a protein that's high in Alzheimer's brain, that's high in the autism brain. And the medicine, which is called TB006, it's not available as a drug yet, that you can get from a pharmacy. It's being studied to get FDA approval. Has been shown to, in some cases, improve cognition in people with Alzheimer's, which none of the drugs for Alzheimer's do that right now. They just slow your progression, so you fall apart more slowly. So this one actually improves cognition. And we're very excited because we think it's going to really help autism. So we're doing a double-blind study right now. It's going to be 45 kids, and we're about 5 or 6 kids into it. So, and then we're doing another study on what's called photobiomodulation, which is where you kind of stimulate the brain with lasers. And it's been shown to improve autism behaviors, and we think it's going to improve seizures. So we had one kid in the study who was nonverbal who started speaking with this photobiomodulation. So there's a lot of this stuff down the road that's coming that is really encouraging. Some of the stuff, like the photobiomodulation unit we're using, is not available commercially yet. It's a special unit, but hopefully with these type of studies, it can become available soon. So we are seeing, and we have a foundation now where we raise money for research and stuff. So we've got several other studies in the pipeline too. So we're really interested in the research because we want to know what works. I mean, I want to use treatments that work. I don't want to spend time wasting time with the treatment that people think works but doesn't. I want to see proof, and that's why I spend so much time doing research, trying to find new therapies, and then also trying to individualize the treatment for the child so that we can make the fastest progress possible. What we're trying to do in the child autism, we're trying to close the gap and catch them up. And now it may take a few years to get there, but we're trying to close, catch them up. Hopefully, and sometimes that does involve diet, medications, supplements, other therapies, and so forth.
How do you think researchers or other healthcare professionals in this field can get a head start or dedicate more time to doing research that could, better support these families?
I mean, the major problem is lack of funding. I've submitted grants, people I work with submitted grants to like NIH, other places, and then turned down, even though they seem like they're really good grants because, whatever. It seems like, for example, NIH really wants to study genetics in autism, which is fine, study it, but they don't want to study really anything else. So when you're talking about new therapies, new treatments, new modalities, they just don't seem to be that interested. So it's a lot of it's lack of funding. I mean, people, if you went to pick your university, UCLA, whatever, and said, I'll give you $3 million to study whether or not COVID affects frogs, they'll do it because you give them $3 million because they need the money to do research. And so they'll take whatever money you'll give them to study whatever you want, as long as it's not, something that's going to hurt society or whatever. So, so people that do research are starving for funds, and they'll study whatever they can. So if you said, hey, I'm going to give you $3 million to study this new supplement for autism, they'll do it. They just need the funding. So there's a big lack of funding right now. So if you could fund some of these things, we can make a lot more progress. But right now, our priorities in the U.S. is not funding these things. It's actually cutting research budgets and spending more on whatever. So it's frustrating. So there's a lot of researchers out there that would do more studies, but they just don't have the resources to do it. They're lacking the funding. We would be doing, I guarantee you, we would be doing a lot more studies if we had the funding. So we got funding to do these 2 studies, and we can do them. And we do studies on the cheap too. We do it for like the study we're doing now is about probably a fourth of what it would cost, because we do it on the cheap as best we can, because we want to see the science move forward. But yeah, we just need funding. Everyone needs funding. And so that's what we're hoping with, maybe the new administration, maybe there'll be more funding available for ASD. That's what we're hoping for.
You make a really good point. Could you also touch more on that website that you were talking about? I'd love to hear more about that.
Yeah, it's going to be a clearinghouse. So it's a place where we're going to have a bunch of the research papers. So I can tell you the name of it. I'm blanking in my mind, but I'm looking at my email real quick. So um, it's the Autism Knowledge Gateway. So the website's not active yet. The website's going to go live, I think, in April-ish, kind of like a beta, and then maybe to more of the public in the fall. So it's going to be a site where anyone can go on there, researchers, parents, whatever, and data mine it. So it's got some AI involved in it. So what we do is we're putting all the abstracts and links to the papers and so forth on the website. We'll have landing pages, like you'll go to the mitochondrial autism, landing page, or the seizure and autism landing page. Well, it'll have an executive summary, like, okay, this is the state of the art. This is where the studies are now. We envision having like a top 10, like these are the top 10 articles that are most important. If it's kind of a controversial subject, we might say these are the top 10 that show a correlation, and these are the top 10 that don't, so people get a balanced view. And then below that will be all the studies. Like there might be, like right now, there's over 500 studies on mitochondrial problems in autism. So they'll all be listed there, but and then the other thing that we envision is you'll be able to rank them. So the thought is that over time, the studies will kind of do, and kind of, okay, this is the top study because everyone's saying it's the highest one. So things will rise to the top, and then people will be able to go to the page and say, okay, this is the top ranked paper that seems to be the most relevant. And so people will go there and be able to search for new, autism related things and so forth. So that's our envision. So we'll definitely be sending out emails and blasts and stuff when that becomes available. So it's going to be available soon. So we're still working on it. And it's going to have probably 50,000 papers and more on it eventually. It's just getting the platform up and running. So there's a lot of, programming and things that are going on behind the scenes that I don't know how to do, but I know how to give them the papers, and they put them on the web. So I wish I could code, but I can't.
Yeah, I mean, that sounds wonderful. That's something I'm going to be looking forward to in 2025. So, with so much research on autism emerging, what's the best way for parents to stay informed?
Well, I'm hopeful that this new website is going to be the ultimate kind of go-to type thing. So that's going to hopefully be it. As far as like, Ataka has a lot of good resources. Autism Research Institute, ARI.org or com, I think has a lot of good research, a lot of stuff online there. Those things are helpful. There's not a lot of books out there, or at least books that are up to date, or the books that are out there are kind of incomplete because they only look at certain portions, so there's not a ton of books to go with. But I mean, I think that once this website is up and running, which should be pretty soon, that's going to be the go-to. Because again, we'll try to synthesize things. But I mean, I think for most parents, it's best to have a doctor who does this type of treatment, who kind of helps them. Parents rely on me to kind of look at the literature and be able to tell them different things. But I learn a lot from my patients, because almost every day someone's bringing in a paper or bringing up something new, and I'm going, oh, okay, let's look at that and see. So I'm always learning too, because parents are always challenging me, like, hey, I read about this, I saw that. What do you think about this study? I'm like, oh, well, that study's actually not really that relevant because or that study's actually really good, or hey, that's a good point. Maybe we should try your kid on that. I didn't think of that. So we get a lot for our parents back as well. So but seeing someone who's knowledgeable, like we have a group of doctors where we train doctors to do this type of care, and it's called MAPS, Medical Academy of Pediatric Special Needs. And they have a website, medmaps.org, medmaps.org, and it has a link to doctors who have been trained in this type of medicine. So that's a good resource too for parents to find someone in their area that they can see and get good advice and so forth.
Thank you for sharing. Now, as both a parent and a professional in this field, your perspective is incredibly unique. What have been some of the most rewarding moments in your journey?
Seeing my kids improve, was huge. Seeing my younger kid in college, live in the dorms. I mean, never thought that would happen. In fact, when he was in eighth grade, the teacher told us, "He'll never graduate high school. He'll never go to college." And he graduated high school with 33 college credits because he took college credits on the side. So he had a semester, or a year done of college before he even finished high school. So, so there's a lot of naysayers too. Why are you doing this? Why are you doing this stupid diet? Why are you seeing this doctor? Why are you spending all that money? Why are you doing, so, you just have to overcome that. So, um, every day, I see kids that are improving, and that gives me a lot of hope. It's not like every kid we see gets 100% better, by no means. But at least once a day, I'm seeing a kid who's made a lot of good progress, which is really encouraging. So, it's great to see that happening. And so you feel like, I feel like God took us autism for a reason. And so we can help other people that are affecting life like us. So, basically, I think a lot of life is being able to help other people who have been affected the way you have, because you can understand, you have skin in the game, you've been there. So, kind of, what it's like. If I didn't have kids with autism, I don't know, maybe I wouldn't be as sympathetic. My kids took like 15 years to get really close to where they need to be. I told my wife, maybe if I had kids that improved like within a year, like I see some kids happen, maybe I just wouldn't have the empathy for parents to be like, what are you doing? Why aren't you getting better? It should take a year or two, right? But now I realize it can take 15 years in some cases. So, so that gives me that perspective, which I think is good too.
Dr. Rossignol, given all that we've discussed today, what do you hope families will take away from this conversation?
I mean, the big thing is that autism is treatable, that it is a medical disorder, we think, not just a psychiatric disorder. It has things that are testable that can cause autism, like mitochondrial problems, seizures, GI problems, sleep problems, all these different things we've been talking about. Those things are testable and treatable, that improvements can be made, that some kids can actually lose the diagnosis. It's kind of estimated maybe 20-30% of kids might lose their diagnosis or get pretty darn close to that. And so I think the number one thing is that autism is treatable, and you just have to seek out the care, and you have to search. Don't be afraid to ask for help. I think a resource like Taka, where they have parent mentors and stuff, is huge, because then you can talk to someone who's already done everything that you're about ready to do, so they can kind of help you avoid the pitfalls. And just basically get up and do something. Start today, or maybe tomorrow, but just get going, and try to help your kid as best you can. Doesn't mean that everything's going to turn out great, but I'd rather go down fighting and trying to get my kid better than to sit on the sidelines. So I think it's just that autism is treatable, and get going. Do something. See a doctor who does this, and try to just keep working and get your kid better. And leave it in God's hands. I mean, you got to trust God too. And there's an old proverb of, trust God but tie up your camel. So you need to trust God, but you also need to do what you're supposed to do too to help your kid get better. So we feel like God brings a lot of healing to what we do, and the knowledge that He's given us, and so forth, to help kids get better. So it's just a matter of just knowing that autism is treatable, and just try to find some way of getting going.
On that note, I definitely agree with you. Dr. Rossignol, thank you so much for being here today. This conversation has been incredibly insightful for me, and I've learned a lot of things, from treatment to your own personal journey, and I'm incredibly grateful for the time you've taken to share your insights. It's been a pleasure, and I'm eager to see the continued positive impact of your work this upcoming year. But yeah, any last words?
Yeah, I think this has been great. I mean, I think you're doing a good service, and we're all in together, right? We're all have kids affected, and we're all either, whether it's a sister or a son or daughter, or whatever, right? We're all in it together, so we can all help each other and pray for each other and be there for each other, right? So,
thank you. Thank you for tuning in to today's episode of Beyond the Blue. I hope you found our conversation insightful and informative. Don't forget to subscribe and share this episode with anyone who might benefit from it. We can't wait to have you back next time. Until then, Stay curious and take care.